That is the public service message for today. And now, moving on, we have got a wonderful show lined up for you. We have the first segment is about, it's something that is prevalent within Pakistan. It's something that we are not very sure about. As we've always said, health is wealth. We even have a show on that on the weekends on PTV World. But there is an issue within Pakistan, and there are many factors that play into why we are having this health issue within Pakistan. Within Pakistan, there is a growing number of people who are suffering from chronic kidney disease, who are actually pushing themselves to the point where they are leading their kidneys to fail. So over here within Pakistan, there are multiple, so it's your dietary, it's your genetics, it's the fact that some culture, within some societies here, there's a lot of interfamily marriages as well, which cause these issues. So we're going to be exploring what is the difference between chronic kidney disease and versus failure, and also how can we prevent it, because in a developing nation, access to health and medical is much more difficult, and quality as well. So we've been joined by Dr. Rashid Ishaque. He is the MD of Senior Kidney Care in Harbin Clinic, Atlanta, Georgia. Assalamu alaikum. Good morning. Thank you so much for joining us.
Good morning.
It's a very important subject that we're talking about right now. So could you tell us, first of all, let's start with the basics. What's the difference between chronic kidney failure and, disease versus failure?
Yes, chronic kidney disease is basically a spectrum of disease which can lead to chronic kidney failure. So chronic kidney disease is a disease like diabetes or hypertension.
Okay.
So it has 5 stages, and the final stage is stage 5, which is the renal failure.
Okay, so before we get to that, so let's talk about, so hypertension and diabetes are part of what's called chronic kidney disease. Is there anything else that's included in that?
Yes, so the most common cause of kidney disease is diabetes and hypertension.
Yes.
And after that, there are some genetic disease like polycystic kidney disease, chronic glomerulonephritis, and kidney stones, and a lot of over-the-counter medications which we use on a daily basis for arthritis, like NSAIDs, like ibuprofen, Aleve, and naproxen. So all these medicine can cause chronic kidney disease and that lead to chronic renal failure.
Okay, and now, so tell us, okay, so we've talked about what is the difference. Now, what's the situation with the figures within Pakistan?
Yes, so like I'm from US, and in US we have quality reporting where we can diagnose and report how much the population incidence of kidney disease. So in US, it's almost 25 million people affected by chronic kidney disease, because it is well reported and well established. In Pakistan, unfortunately, we don't have any national database which will tell us how many patients are suffering from chronic kidney disease. There's a study done in Karachi where they just randomly screen the population, and they say it's more than 100 patients per million who are on dialysis, which is a treatment for renal failure.
That's the failure, that's the way we're at the end. Okay, so those are huge figures. So now, you mentioned very briefly about the reasons why, but let's get into that a bit more, because there are some preventative measures that can be taken. So what are the risk factors? You said that
diabetes and hypertension,
and then also some family genetics as well.
Now
the thing is, diabetes and hypertension, that comes from lifestyle as well as genetics, correct?
Correct.
So that is something that people can take control of. So now, what kind of lifestyle changes or what kind of things should people do?
Yes,
who are more at risk, actually? Tell us first.
Yes, so basically, so there's 2 situations where first we have to diagnose chronic kidney disease, because if we don't diagnose, we can't prevent and treat. So first is to identify the patients who have chronic kidney disease. And then to identify the simple blood test.
Okay, so what are the symptoms for someone who should go and get themselves checked?
Yeah, actually, unfortunately, in early kidney disease, in early stages, there are no symptoms.
Oh, no, okay.
So the only way to check is through the blood test, where it's a simple test called BUN, urea and nitrogen, and creatine. And that drives into GFR, which is the glomerular filtration rate, which tell us how much kidney is working.
Okay, you're using words I think majority of us and our viewers will not understand, but they're very medical and technical terms. Okay, now just for your layman out there, so there is no, you can't really tell because there are no symptoms initially. But the thing is, do they come up if you go for regular or body checkup? If you go up for a general health checkup.
Yes, there can be some vague symptoms like nausea, vomiting, and people have complaint of tiredness and fatigue.
Right.
And then in the later stages, people have shortness of breath and loss of appetite.
Oh, okay.
So there are a sequel of symptoms which happen in the early stages versus the late stages.
Okay.
And the risk factors are so diabetes and hypertension are the most common risk factors. So these are how a patient can be identified as a risk factors. So people who will tend to get into chronic kidney disease.
Okay, so that's standard, because if you already suffer from these things, you should get yourself checked. But now, I think I feel like I'm going through my psychology degree all over again. I feel like I've got these issues as well. I'm going to have to get my blood checked afterwards. Anyway, so now let's talk about the risk factors which people can control, because there's certain things they're unable to control. So does your diet, does anything like that have an impact?
Yes, so most common thing which people can work on is their
But what are they
diet.
doing that's causing them?
Yes.
What actions are causing them to lead them down this path?
Yeah, so in our country, in Pakistan, the most common risk factor, I would say, in lifestyle is a high protein diet.
Okay.
So people eating a lot of protein, a lot of meat, they tend to have a lot of burden on the kidney.
Okay.
So people who are diabetics and they are doing the eating a lot of protein and high carbs diet, that can be risk factor for the.
Oh goodness, I'm doing all the wrong things. Oh no. Okay, right. Now let's move on. Let's get serious. Okay, so now this high carbs, high protein diet, so you should have a balanced diet, which is something that we've been promoting and telling you guys and showing you different vegetables and fruits, etc., especially which are they're regional as well and seasonal within Pakistan, which are fantastic. But now let's talk about the social issues. Like, is there like I was reading that if you continue repeating the similar genes, that can also lead to having chronic kidney disease. Is that correct or not?
Yeah, that's correct. Actually, genetic factors are very common and they can lead to chronic kidney disease. So number one, diabetes is a genetic disease as well. So, but not all diabetics get into chronic kidney disease.
Right.
There are certain genes which lead to a chronic kidney disease.
Okay.
So that is very important. And then there are certain autoimmune diseases which is like comes from your body immunity, a lack of immunity. So one of them is polycystic kidney disease.
Yes, you mentioned.
That is, effective with in a certain genetics, And then there are certain disease where people lose blood in the urine, where there has a defect in the kidney. It's called IgA nephropathy, which can also be genetic. So there are a lot of genetic diseases in the kidneys, which can lead to, kidney disease. And actually, in pediatrics population, there are a lot of genetic malformations in the kidney, where a kidney fail to develop when the child is born.
Okay.
Because in the developmental phase, when before the birth, the kidney develops, but at birth, both kidneys develop and then they evolve into a functional kidney.
Right.
But unfortunately, a lot of kids are born with only one kidney.
Why?
That is a genetic cause as well. And there's no way parents can know, since in Pakistan, in the prenatal care, we don't do specialized ultrasonograms to look into the body organs.
Okay.
So we fail to diagnose those. And later on, when those kids grow up, they develop diabetes and hypertension.
Right.
They are very high risk of getting chronic kidney disease.
Okay, and that's why you mentioned all these people are on this dialysis, 100 people out of a million, which is a huge figure. Okay, now let's talk about the treatments that are available out there. Okay, we know in developed nations, you have to go for regular checkups. There's systems in place where you can go and set. Over here, some hospitals do, some government hospitals are providing it, but it's not everywhere. But what are the treatments available out there for?
Yeah, so treatment, as we mentioned before, start from lifestyle modifications and the diet. And after that, controlling the risk factors, which are diabetes and hypertension. And then there are certain medications which we use in the early stages to treat the chronic kidney disease, to treat the complications of them. So when we start seeing patients in the chronic kidney disease clinics, we check all those metabolic parameters and then we treat accordingly. And the main goal is to delay the last stage, which is the chronic renal failure, or we call it end stage renal disease in other term. that's when people need dialysis.
Right. Okay, now the thing is, at what point is it too late to reverse? Like after which stage? 1, 2, 3, or 4?
Yeah,
Obviously 5, you can't go back
yeah,
from
the
that.
best stage when a primary care doctor or general practitioner in Pakistan, we urge to have them refer the patient when they are in stage 3.
Okay.
And when the kidney function go below 60% out of 100%.
Right, okay.
That's the right time to refer to a nephrologist
Okay.
who's a kidney specialist.
But over here within Pakistan, because you know you are here to speak about the situation, what is the situation with the nephrologist and the kidney disease treatments?
Yes, actually, when I finished my medical school I started in 1996 and finished in 2001 from Punjab Medical College, Faisalabad. We only have one nephrologist in our whole hospital,
Okay.
and we have only few dialysis machines. But now, I have seen that all of the major cities have kidney care centers and dialysis centers, and now Pakistan Medical and Dental Council have initiated a nephrology training program.
Wonderful.
Where they are training a nephrologist, which is a big improvement. And eventually, it has to evolve into specialized dialysis centers, and ultimate treatment of kidney disease is kidney transplant.
Okay.
Which is the ultimate treatment where people don't have to do dialysis.
Okay, so over here, what is the situation with the transplants?
Yeah, in Pakistan, the leading institution in transplantation is SIUT, which is Sindh Institute of Urology and Transplant.
Okay.
And that is the leading institution for transplant. But unfortunately, we don't have many transplant lately. We used to have living donor transplant where some of your relatives or friends give you the kidney. But now in the previous government, they have approved deceased donor transplants, which is like cadaveric, where people who died in the accident or early age, they harvest the kidney and transplant to a patient.
Okay, so that's happening in Pakistan?
That's happening in Pakistan now.
Okay, wonderful. And what are the success rates regarding when you have these transplants? If you have to have a transplant, what is the success rate?
Yeah, so success is pretty good in living donor. So the average survival rate, people who are receiving a living donor kidney from their relatives is 20 plus years.
Oh, wow.
So their kidney can last more than 20 plus years.
Right, okay.
And the disease, cadaveric kidney success rate, I don't have a data for Pakistan, but in USA, it's pretty good. Its average is 10 plus years.
That's amazing. That's fantastic. And over, like, what's the affordability of these procedures? Because I mean, we're talking about the end stages.
Yes.
What cost are people looking at?
Yeah, so to get the living kidney is less expensive than the deceased kidney.
Okay.
Why?
So,
because living kidney is donated by your relative, so obviously you're not paying him to give the kidney. But the main cost is the surgical procedure cost, and later on the chronic cost is the medications you use to keep the transplant kidney healthy in your body.
Okay, so basically what we want to sum up from this is that it's better to go and get yourself tested and know what the state of your kidney before you reach the failure stage, because that's much more expensive to maintain. Or what's more cost effective as well, because people that doesn't have an impact.
So dialysis, which is one of the treatment for chronic kidney failure, is very expensive. The average cost of one dialysis treatment is around 5,000 rupees in Pakistan.
Okay, and how regularly do people need to have it?
They at least have to have 3 days a week, which is the standard of care. But
so you're looking at least like 15,000 rupees a week.
But
that's
unfortunately in Pakistan, due to affordability, people go only once a week, sometimes twice a week, or sometimes once a month.
Okay.
And that build up the toxin level in the body, and that further damages the vital organs in the body, like heart, bones, and a lot of vital organs.
Okay. Okay, I had one more question, but it's absolutely slipped my mind. You're not talking enough for me to remember it. Okay, so now, and that's it. How many donors are there, or how, this is such a bad word, I'm really scared to use it, but the resource, I mean, for like people getting the transplant, I mean, is there a long waiting list, or are there plenty of kidneys out there for people to...
Yes, so in USA, there's a average wait time of 5 years.
5 years?
Yes.
Oh, wow.
But that depends on your blood group.
Okay.
Your blood type. Certain blood types can get the kidney very fast, like AB blood type can get the kidney like in a few years. But the O blood group is very have a long waiting time.
Okay.
But going back to the cost of treatment, as we mentioned, the dialysis treatment is very expensive. But now there is a dialysis we call home dialysis. People can do dialysis at home.
Right. Okay.
That is more cost effective and it's more outcomes.
Are we there in Pakistan where we can do home
Yeah,
dialysis?
it is actually very old. It's called peritoneal dialysis, which
Okay.
people do from their stomach.
Okay. So the old school with the big machine, correct?
No, it's a small machine they
Okay.
do every night
Okay.
before going to the bed, and it does not involve any blood.
Okay. And how much does that cost?
That is less expensive because the only thing you need is a fluid to put into your abdominal cavity, and that do natural dialysis.
Okay. Wonderful.
But the other dialysis is called hemodialysis, which involves blood and has a lot of complications.
So you have to go to the hospital for that.
Yeah, for the outpatient center.
Okay, wonderful. Okay, great. Thank you so much for your time. It's been an absolute pleasure to have you on the show. Guys, I hope you took something away that prevention is better than cure. And once you get to kidney failure, then there is no going back. And it's a world of pain for yourself and for your loved ones around you. So do look after yourself. Make sure you go and get your blood tested. Go to your doctor and say, just do a full body, because we keep telling you every 6 months to a year, you should go and get tested for any illnesses that you may have. And with that, we're going to go for a short break. But when you come back, we're going to now talk about how to get our brains healthy and our minds healthy. Stay tuned.